So just as a brief way of introductions, Dr. Godfrey Su is a facilitate lead on the Global Parenting Initiative. He is a behavioral scientist with training in the public health and medical anthropology and sociology, and is currently working as a senior lecturer in the Department of Child Health and Development at Makerere University, Uganda. Dr. Jamie Lachman is the lead principal investigator at the Global Parenting Initiative, and he leads the Evaluate theme, or Evaluate brick, of GPI. He is a senior researcher and teaching fellow in the Departments of Social Policy and Intervention at the University of Oxford. And then we have Dr. Betty Octon, who is currently an early career researcher, also at Makerere University. And so I'll hand over to the presenters. And just a reminder that we are recording. We'll have 40 minutes for presentation, and hopefully we'll get about 15 to 20 minutes of Q&A at the end. Thank you. Over to you, Godfrey.
Thank you very, very much, Jenny. And thank you, Annie and Catherine, for putting all of this together. So good to see you all. Good morning, good afternoon, and good evening, depending on where you are. Greetings from Kampala in Uganda, where myself, Godfrey, and Betty are based right now. It's really nice seeing you. It's a great opportunity that we have today to share with you preliminary results of a study, a program that we have been developing over the last couple of years called the Uganda Parenting for Respectability Implementation Science Evaluation. So what we are going to do here this afternoon in Uganda is to share with you the cluster randomized control trial of a homegrown parenting program to reduce violence against children and gender-based violence. As I said, we will be sharing with you preliminary results pending publication. But the results are quite interesting, and we are really happy to have the opportunity to share them with you. So myself, Jamie, Betty, and myself, Godfrey, will be presenting this on behalf of a wider team. We're quite a big team that includes Professor Daniel White, who has just retired from the University of Glasgow and is based in the UK. And also I need to mention a very important person in this project, Caroline Namtebi, who has been one of the brains behind this project from the start. There are others whom we might mention along the way, but I think that should be sufficient for us right now. So thank you very much. I now want to move to the next slide. Next one. Just to give you a little bit of background about this project, we all know that there is a link between intimate partner violence and violence against children. And this relationship is documented in all settings, particularly also here in Uganda. The co-occurrence of intimate partner violence, violence against children, has been recently documented in a National Violence Against Children survey. And we saw from this survey that surveys that 36% of women in Uganda experience intimate partner violence, or IPV, and 22% of which is usually sexual violence. The Uganda National Violence Against Children survey, completed a few years ago, found that 59% of the girls and 68% of boys experience some form of physical violence in their lifetime. And that's really a disturbing statistic that requires intervention of in all settings. Now, factors associated with both violence against children and intimate partner violence have been documented to include these four: poor parental attachment and bonding, inequitable gender socialization of children, harsh parenting practices, particularly in the form of corporal punishment, and the existence of spousal conflict and respect. These are some of the main factors that can be found in the literature all over that predict the likelihood of a child being experiencing physical, sexual violence, as well as their parents. There is emerging evidence of the impact of parenting interventions in addressing intimate partner violence, as well as violence against children. And particularly if interventions are addressing this problem from a gender transformative approach, then the results are likely to be quite promising. And so, could you move to the next slide? Based on this, sorry, I think I'm getting a lot of notifications that are covering the screen all the time. Sorry about that. So we designed parenting for respectability, just the slide before, sorry. Yes, that one. So we designed a parenting program called Parenting for Respectability in a few years ago. And the background to this was that we did a review of existing literature and found that very few parenting programs deliberately seek to address both intimate partner violence and child maltreatment. And yet there's evidence that the two are interlinked. We also found that few programs leverage cultural drivers of pre-existing motivations for behavior change. For instance, the motivation by fathers or mothers, and what encourages them to get involved in parenting programs. So Parenting for Respectability was in part designed to address this as a homegrown parenting program, because also what was very clear is that while evidence of effective programs was increasing, the evidence was mainly from high-income countries, and very few programs had been transferred successfully to resource-limited settings. So we designed a homegrown parenting program whose main principles were to harness the pre-existing motivations around parents to improve the engagement with children and to reduce violence against children, as well as perpetration of intimate partner violence. Next slide. So, next slide, please. As we designed this program, found that 4 distinct features make this parenting program unique. First and foremost, a focus on parents' desire for good behavior and family respectability. I must say that I've been involved in research before with men, and we engaged men and found that one of the things that motivates the engagement as family is the desire to improve family respectability, not just the respectability of the father and mother, but of the entire family. So we realized that a family-focused approach was probably going to be productive. The second thing that we considered unique is to deliberately engage and include fathers, because many parenting programs are often designed and presented as parenting programs, but fathers rarely see that as parenting programs targeting them. Thirdly, we built on parents' confidence to positively identify solutions through discussions and reflection. So the program is very much participatory and is led by a local facilitator who leads parents into a process of reflection and discussion. And fourthly, the aim to promote healthy spousal relationship through a reflection of spousal relationship, communication, social norms, as well as the existence of IPV in the family. So these are some of the key features of parenting for respectability that have been so unique, and we use them as a way to promote the program. I do not have enough time to take you through this theory of change. It's quite complex with so many arrows, but just to let you know that the mechanism of change assumes that through a process of engagement, through a process of reflection and harnessing pre-existing motivations, parents can engage in a process that can eventually lead them to address the 4 main risk factors that I had mentioned before. So I'll just go to the next slide in order to summarize this, that the mechanism of change is that this is how we intend the program to operate, that if we subject parents into a number of sessions and content that we develop, then we are likely to see a greater commitment to improve parental bonding and attachment. We will see less authoritarian parenting. We will see commitment to support children's education, less parental conflict, and modified gender norms, which ultimately should reduce gender-based violence and violence against children. Next slide. So in terms of the program structure and delivery, the program is based in the community. So it's community-based, it's not house to house, it's group-based, and it begins with men-only program, men-only groups, and then eventually women and men are mixed together. The sessions are 2 to 3 hours, sometimes less. 16 sessions altogether. The first 9 are single sex, and the last 7 are mixed sex groups that bring together both men and women. Usually the final session is a community graduation event, to some kind of gathering that brings everybody, including families or family members who didn't attend the program. The Parenting for Respectability is delivered by peer facilitators who are usually nominated by community members themselves. Once we mobilize parents and we get a sufficient number of them, we ask them to identify those whom they think can be trained to facilitate the sessions. So altogether, we have 4 facilitators per group, and usually these are balanced by gender. These receive a 5-day training, and this is followed by usually a top-up training along the implementation. Sort of after 9 sessions, then we come and provide additional training. So this is just an illustration of what happens. So we have men and women attending their groups, and we produce quite a number of materials. We produced an attendance, produced a manual. We also have an attendance register and other illustration materials. The person you see on this is actually Carol, who has been the lead trainer of trainers. Next slide. So I just wanted to show you the development and the evaluation of the Parenting for Respectability over the years. We started this work actually quite some time back in 2013, in which we initially drafted the program and piloted it in 2 communities around Kampala. The purpose was to design and conduct formative evaluation to answer preliminary questions around around likely acceptability and to see the kind of sessions that we might be able to retain or to reduce. So initially, from a 21 session program, we reduced it to 16 sessions based on feedback from the pilot study. In 2017, we did a proof of concept study with over 600 parents receiving the intervention. And the aim at this time also was to begin to work with a potential implementing partner, because as a university, we are not really program implementers. So we worked with an implementing partner called the SOS, which is a child care organization. Around about the same time, we started seeing interest in other partners wanting to implement Parenting for Respectability, and we shall be talking about that later with respect to scaling opportunities. In 2020, we had a great opportunity to do a randomized control trial with over 2,000 parents in 2 districts in Uganda. And these are the results that we are going to be sharing with you today. And as I said, these are just preliminary results pending publication. So I had to stop here and to invite my co-presenters to come in and proceed with the rest of the presentation.
Thank you so much, Godfrey, for that wonderful overview of the development and content of Parenting for Respectability. Just wanted to note that now we are 10 years from its initial inception period, and there's so much more excitement that Godfrey will be talking about with the scale up and dissemination to other contexts around the world after we share about the results from our trial. So I'm going to co-present this with Betty Okot, who we're going to be sharing the quantitative and qualitative results from the Uganda Parenting for Respectability Implementation Science Evaluation. And the aim was really 2 points. One was to test the effectiveness of parenting for respectability in comparison to a 2-hour lecture, which we called Parenting in a Nutshell. We were looking at our primary outcomes of violence against children and intimate partner violence, both reported by parents and by children ages 10 to 14, and then also secondary outcomes associated with risks of violence. We also wanted to look at the implementation factors that might impact the effectiveness and scalability of the program. And so we looked at the differences between geographical regions, types of communities, and kinds of facilitators, which ended up being peer or a mixture of professional and peer facilitators. The study design was a hybrid type 2 design. It's in fact looking at effectiveness plus implementation. And it was a cluster randomized control trial that was conducted in 54 village clusters. 28 of them were up in the northern part of Uganda in Amuru, which is an area that was also affected by conflict over the past 2 decades. And then 26 were in Wakiso, which is the area that surrounds Kampala and Tebi area. We did a 1-to-1 comparison. So it was either the village got assigned the Parenting in a Nutshell or in Parenting for Respectability. And the lecture group was delivered also by community facilitators. And by and large, to the best of our ability, we tried to deliver the same content as the Parenting for Respectability. So it's providing them with the knowledge, but maybe not the same experience and over time to practice and develop skills with the supportive facilitators that the Parenting for Respectability program offers. The data was collected using tablets. During the COVID-19 time, we got special dispensation from the Ugandan government to collect and conduct the study because of its relationship to preventing violence against children. And we collected both quantitative and qualitative data. And this was during when schools were closed. And it was quite remarkable that we were able to continue this trial during the COVID-19 pandemic. Recruitment was done in collaboration with our implementing partners, SOS Children's Village. There were 108 caregiver groups and more than 2,300 parents were recruited. About 46% of these were male, which is really wonderful to see high male recruitment into the study. And then we randomly selected from each household a child if it was present between the ages of 10 to 14. And our sample was 844 children. We also trained 208 facilitators in either the Parenting for Respectability or Parenting in a Nutshell. You can see the kind of breakdown by gender for both groups. So the cluster randomization, for those who aren't familiar with this design, we had 54 villages that were selected and assessed at baseline. Then we did a random allocation and randomly allocated either to the Parenting for Respectability or the Parenting in a Nutshell. Those programs were delivered over the course of 16, roughly 18 to 20 weeks. Then we did a post-intervention assessment, which was followed by a 6-month follow-up in August, September 2022. At our retention for this, we had pretty high retention, especially given the kind of difficulty in finding people at post-test and follow-up. So more than 3/4 were retained of the adults and up to 80% for the follow-up, which is quite nice that there was consistency also. And most of that was due to relocation or the fact that people just weren't contactable because they moved or had changed their contact details. So thinking about the quantitative methods for analyzing, we looked at pre-post and follow-up comparisons between Parenting for Respectability and Parenting in a Nutshell. We first would examine the distribution of the variables to kind of determine what kind of analytic strategy were we going to use. And the flowchart here shows you how we would look at a normality test, then to decide whether it would be linear regressions or looking at multi-level Poisson regressions or negative binomials. We used an intention to treat analysis, and the analyses had the independent variables and allocation time, and then a time and allocation interaction effect. We used covariates for region and nested the random effects at the cluster and participant level. The data analysis was done by members of the team at Oxford University, led by Dr. Ching Han, and they were blinded to treatment allocation, which means that she did not know which groups she were analyzing had been assigned to the PFR or to parenting in a nutshell. And I hand it now to you, Betty, to describe some of the qualitative methods.
Thank you very much, Jamie. Taking on from this point, we collected qualitative data through mainly focus group discussions, interviews, and participant observation. During the intervention, we took a number of visits to the field to see the delivery in progress, how facilitators were working with the parents and how parents were actually responding to the program. And we got a lot of insights about their perceptions, and we also found a lot of convincing material about the effectiveness of the program. In terms of focus groups, we did 8 focus groups in total. 4 were in Amuru and 4 in Wakiso. Then for the interviews, we did a category of participants. We interviewed facilitators, parents, children, and community leaders. In total, between the 2 districts, we collected about 100 interviews. And as I speak, we are still in the process of analyzing the data, since right now we're just talking about the preliminary findings. Could we move to the next slide, please?
Thanks, Betty. Just to add that we are also conducting moderator analysis of the key implementation variables and subgroup analyses by gender. And the analyses that you see in italics are ongoing and continuing. So we're still lots of data and lots of analyses to do. So now going into the baseline characteristics of the sample. Most of the parents were partnered, as this was a program that was lived both men and women, but we did not exclude people if they were single. So there were 12% that were single. Most of the parents had some level of primary school, but there was a good proportion that didn't. And we also had around over a fifth of the population had low or no literacy, which meant that, you know, we had to really kind of think about how the program would be delivered to people with low literacy levels. With the children, 11% of the population were self-identified by the parents or parent-identified of children living with one form of disability, at least one form. Interesting, most of the kids were enrolled in school, but none of them were attending school. Uganda had the longest period of school closure during the pandemic. And 11% of the population of the children were either single or double orphans. Children and parents, this is the child report of prevalence of maltreatment in the past month. We'll see that there are slightly higher levels of reported maltreatment by female parents. And this is primarily due to the fact that female caregivers are the ones who tend to spend more time with their children in managing their children's behavior. But still high levels for both female and male parents. We also looked at adult report of the prevalence of intimate partner violence, and we're seeing that roughly equal reporting from the male and female side about perpetration by men and victimization by women in the sample. The missing data were people who we did not make people respond to these items, so they could choose to skip the IPV assessments. So now we're going to share some of our preliminary findings, and the way it will work is that I will share some of the quantitative data, and then Betty will provide a little bit more in-depth understanding through the qualitative findings as well. And these are preliminary, they have not been peer reviewed. We are hoping to submit a publication in the next month or 2 for that. So looking at the attendance of Parenting for Respectability, they attended about 61% of the program, which is 11 out of 16 sessions. Women attended slightly more than men, but still high level of attendance for men. With the Parenting in a Nutshell, the attendance was much lower, so only 50% of men and 43% by women, with an overall attendance of that 2-hour lecture of 46%. The quality of delivery, which was assessed by live observations that Betty looked at. They also did a quantitative assessment of a tool that was adopted from the Parenting for Lifelong Health facilitator assessment tool, which looked at how well the facilitators modeled behaviors, did collaborative facilitation, and managed the group. And the mean quality of this was 63%, or 47 out of 75. We looked at what predictors were associated with better or worse quality of delivery, and found that older facilitators slightly less quality delivery than younger facilitators, but we saw no difference for the location of the communities or by facilitator gender. So men and women delivered at roughly the same amount of quality or level of quality, and both in Amuru and in Wakiso, there was similar levels of quality of delivery. Betty, do you want to give us a little bit more insight into the feedback on program delivery?
Yes, please. Based on our qualitative engagements or interviews, we found a lot of different perspectives about how the program was received in the community and how parents actually were responding to it or putting the learning into practice. So we collected a number of voices to help us add meaning to some of the figures we're sharing. Many of them felt that the program worked well because the community-based approach. Earlier on, when Godfrey was talking, he mentioned that the facilitators were drawn from the communities. They were peers. And when we refer to them as peers, we are talking about the ordinary people in the community who live there and interact with these parents almost on a daily basis. They are well known for different reasons. Some of them are known because perhaps there have been teachers in the community, others because they have local leadership and the opinion leaders, others are just ordinary citizens who are known to the people. So they thought this was really, really important because the people who were training them actually knew what was going on and they connected with the problems. So in one of the voices, a participant told us that the method that we used was good because if we had gone through churches or mosques and other institutions, perhaps there would have been a little bit of a gap between the participants and the people that were bringing the program to them. So this was intimated by a man from Wakiso. Then in Amuro, we heard from the participants that many of them actually took the program as a priority, even if they had things to do in terms of livelihood commitments and whatnot, they would still spare time to come and attend. So this woman told us that, I think the program was not difficult from my experience. The activities were easy. They made us talk and think about our lives and what we were doing right or not right as parents and married people. So for me, it strengthened our capacity and the parents learned how best to support each other and at home, despite other commitments. So they thought that the content was real. Why? Because it touched their everyday experiences as parents and spouses. They touched the kind of challenges they had as parents, and they touched the issues that they were dealing with on a daily basis. Thank you. Next slide, please. Back to Jamie.
Betty.
Thank you.
Now we're getting into some of the results and really excited to show you these, and there are a lot of them, so please bear with me and I will spend more time on the primary outcomes and less time on some of the secondary outcomes, just highlighting some of the interesting or promising results that we found there. So here we have parent report of the number of times in the past month they used either physical or emotional abuse on their children. And we're seeing at follow-up 6 months later, a 49% reduction reported by parents in the Parenting for Respectability group and compared to those in the Parenting in a Nutshell. What is encouraging is that that slope is increasing, so the effects are even getting stronger at follow-up in comparison to the post-test results. And encouragingly, the children reported similarly at follow-up. So you could look here and see, but they're reporting both on their parent, female parent figure and male parent figure, and the parents in both the lecture and Parenting for PFR groups both reported reductions at post-test. Now, 6 months later, we can see a regression to the mean of those who were in the lecture group, whereas the impact of the program reducing number of times in the past month of child maltreatment even got stronger at post-test, at follow-up. When we looked also at post-test, we looked at like the impact of taking in consideration the attendance. We also found that there were larger effect sizes at post-test for those who attended more of the program in comparison to those who complied with a set amount of sessions, which we set at 50% of both the single sex and the combined gender or sex groups in comparison to the normal results. So we're seeing that more attendance also means more reduction in violence against children. Looking at secondary outcomes, you're seeing follow up. All of the ones physical abuse and emotional abuse are maintained. At post-test, we found that only female caregivers reported child emotional abuse, but we did not see any differences between genders at follow-up. Same going on with other secondary outcomes related to child maltreatment. We found corporal punishment reduced, both reported by parents and children. At follow-up, we did not see any impacts on community of sexual violence. We did not detect any of effects on community sexual violence, community physical violence, or child sexual abuse, but these were very, very low reporting in our samples, so very little room to change. And we didn't see any differences in our subgroup analyses by parent gender. Back to you, Betty.
Yes. Again, talking to the participants, the parents, we learned that they thought because of the program, their parenting practices were changing and the parenting styles. This female parent in Wakiso pointed out very clearly that the parenting styles, because in the content, we had a section that was an activity that was dealing with parenting styles. And parents were given home activity, home practice to go and try this out at home. And one of them was this idea and concept of praising the child in the moment. If that child has done something good, talk about it there and then so that they go away with the positivity. So this parent told us that when she tried it, it worked because she thought it touched her, that when they do well, you have to praise them. And even when a child does not perform well on a task, you still praise them. In other words, this was something new to these parents, because in the past, I think most of their approaches were, if you did wrong, I deal with you the way I normally do. But this time they tried something new and it was working. And now there was a lot of listening and spending quality time with children. Parents had time to play. In Uganda, we have a simple game that most people play at home called the dodgeball. You throw the ball, and children normally do this by themselves, among themselves, but the parents were participating in it. Females, mothers were doing this with their daughters and sons. Even fathers were joining in such games and football and all that. And they thought this helped them to understand their children a lot more. And then the difficulties they had in the relationships were beginning to wear off. Some of the parents thought they had been so rude and tough on the kids before this, but now they were thinking and doing things differently. The idea of referring to a child as stubborn all the time when that child is not listening was changing as well. So move on to the next slide. So from the men, we also collected interesting ideas and voices. Most of the men were now looking at their roles in the families a lot more differently, and they were beginning to help or get closer to the children and their mothers, more male engagement, as we call it. They had playtime, they had family time, they had school time, they had all sorts of, time with the children. So this father from Wakiso told us that he learned that both husband and wife are meant to work together and to listen to the child and play with them. So that is open to you and bring up the child in good behavior. The concept of respectability kept coming up and coming back to us. Then men understood more about their responsibilities. In the past, some of them would think that, okay, if I provided school fees, that was enough. Or if a child is sick, I tell the mother, give her money to take that child to hospital, but they're doing that together now. And men were also participating more in childcare. This father in Amoro said, I am now more involved in chores like firewood fetching and cooking, making the millet dough. And I also bath the child, bathing the child and no longer beating them. This was a change in their view. Thank you. Could we have the next?
Thanks, Betty.
I think
so
that's
now,
back to Jamie. Thank you.
And now moving to our findings on our other primary outcome, intimate partner violence. Here, we're seeing reductions both at post-test and follow-up, with parents reporting 51% less perpetration and 53% less intimate partner violence. And what was encouraging is we actually found this both reported by men and women across both forms of violence. Children also reported on the partner conflict, which is the number of times in the past month. And we found that there were also large reductions in partner conflict reported by children at 6 months follow-up. We did not see these differences at post-test. So the effects were growing stronger at the 6-month follow-up. We also looked at the role of attendance, and like the other one, we found that more attendance that you do actually increased the effects of the self-reported perpetration and victimization. So more that you attend, the stronger the effects are. Looking at the secondary outcomes at both post-test and follow-up, we're seeing that there's also reduced coercion, perpetration, and victimization. We found reduced perpetration and sexual violence victimization. Subgroup analyses showed that this was only reported by women, which would be to expected. Also increased negotiation at follow-up and increased positive child partner relationships reported by children at follow-up as well. Back to you, Betty.
Thank you. Yes, parents told us about how they were relating now since the program started. And they thought that they had more equitable gender norms. And this was happening at the home front mostly, but the community were also hearing about this because it happened in plain sight in front of them. So these days, I see the men walking beside their wives. Sometimes the man carries the child while the woman is carrying firewood. The men fetch water and support their wives. In the past, you would not see this. You would not see these things happen. Today, even when the wife is at home, he still goes to fetch water, and nobody's forcing them to do this, but they have been enlightened by the program. So they definitely attached these changes, however minimal they may have seen them, to the program. And the fact that most of the men had distanced themselves from, family activities, home chores. And after trying this during the program, they thought, oh, it can be done. And I remember in one of the illustration materials, we had a picture of a man who was walking barehanded, just smoking and just strolling around when his wife had a huge load of firewood on her head. And you share these pictures with the parents, and then they look at it, the reactions were different. So I thought this perhaps also went and influenced how they were relating at home. So from that point on, they pointed at improved intimate relationships, because now wives could talk and work together with the husbands. The husbands had time to help other than leaving things to the woman alone. I used to be rude, including in the bedroom, this woman said, but now I improved my marital relationship. My husband no longer comes back home late, and I welcome him and give him bathing water. We actually now talk well. So in the past, before the program came, everybody was to himself. The man thought spending time outside the home was better for him. And the woman thought, okay, if he comes back late, why should I bother? But they reflected about how they were relating and how they were doing things in the home, and began to change. And most of these changes were related to the activities and the sessions they did as a mixed group. Many of these testimonies came out. Thank you.
Thanks, Betty. Now I'm going to move quite quickly through the next of the slides just because of time, and we want to get to be able to have questions and answers. So I'm just really excited to share the positive results on increased equitable gender socialization by parents, increased respectability, respectful behavior by children, and encouragement of that by, and also increased communication around sexual behavior, both reported by parents and children at follow-up. We also found increased positive parenting and positive monitoring, especially at follow-up. No difference between gender around this. And then we also saw what was encouraging is even during the time of COVID, we're seeing increased aspirations by the children who received Parenting for Respectability and increased support of education by the parents, reported both by the parents and also by the children at follow-up. We also looked at child behavior and found reduced behavioral problems, both externalizing and internalizing problems at follow-up, and increased pro-social behavior reported by the parents, both at follow-up, post-test and follow-up. And then lastly, the other outcomes that we looked at, we also looked at parental mental health, and we're seeing reductions of parenting stress and parenting depression. We saw reductions in food insecurity. So parents are reporting that there is reduced food insecurity in the past month, and increases reported by the parents in the provision of child necessities. We also saw children reporting on reductions in caregiver substance use at follow-up, which was mostly focused on alcohol use. To you, Betty, briefly.
Yep, thanks. Great. In terms of food security, what we found in Amuru was that some of the men in the past would just take whatever harvest there was in the house and sell without asking, and that would lead to conflict in the household. But at this point, many of them were saying that since the program, they stopped doing this. The man said, I would sell the crops and did not mind giving accounts, but now we discussed the sale and planned for everything together. So they were thinking and making decisions collectively, which improved the household resource management and security, especially food security. Move on. Thanks. Great. Then the children also told us that there's less conflict in the family, and then increased involvement of children in whatever activity that involved the entire family. They were not left out. This child, a boy, said before it was in a kind of a bad way. My parents liked quarreling, but now they are living well. They don't quarrel anymore. And because of that, even our relationship is better. Then the girl said there's an improved communication between them as children and their parents. They'll talk about a number of things, even talking about avoiding sexual abuse and how to protect themselves in the communities when they were on their own. So she said, since starting the program, my mother talks to me more politely, most especially when I've done something wrong. In the past, it was hitting, actually. I also relate with my father well, because I tell him things and he gives me advice. So parents thought this was related to the, children related this change to the program. Thank you. Could we move on?
Thanks, Betty. So just quickly in summary, so we're seeing that we had really positive results for Parenting for Respectability in comparison to parenting in a nutshell across almost all of the outcomes, which is really remarkable. And I've never been part of a study where I've seen such strong effects, especially at follow-up, and that the effects were even stronger at follow-up is even more remarkable. Than the impact of the lecture really faded after the 6 months. So initially there was fewer intervention effects at post-test, but the impact of the lecture faded at follow-up. And that most of these effects were by and large equal for both male and female parents when we looked at subgroup analyses. Another thing that was quite encouraging is that the child assessments also supported the parents' report. So there could have been an element of desirability from the parents' report, but these are children who were not part of the program, and they were still reporting positive effects at follow-up, not at post-S. So we saw the reduced overall maltreatment and reduced overall intimate partner violence, including perpetration, victimization, coercion, sexual violence against women, and improved partner negotiation that was reported by children. We also saw a lot of positive effects on most of the secondary outcomes linked to violence, increased equitable gender socialization, improved positive parenting, increased supportive education, increased investment in basic child necessities, reduced food insecurity, reduced parental mental health issues, and improved child behavior and mental health. And what was also very encouraging from the results is that we found that the subgroup analyses by gender found very few differences between male and female parents, and that higher attendance did show greater intervention effects, even though even without taking those attendance into consideration, we were finding good effects across outcomes. Betty?
Yes, great. In the qualitative arm, we found that through PfR, spouses can be made aware that gender stereotyping and adherence to negative norms of masculinity are damaging to marital relationships and even family relations. So this came out a lot more clearer from all the activities and the testimonies we collected. And I'm sure that when we finish the analysis later on, we might find very interesting conclusions around this. Also, we found that PfR has the potential to help parents explore and re-examine the different aspects of gendered expressions in their relationships as spouses, and to also think and adapt, reflect on what they're doing and adopt positive parenting practices and approaches, as we saw from the testimonies and the voices of the parents themselves and what the children were saying. All these were attributed to the program. Thank you.
So over to Godfrey for some final thoughts.
Yes, thank you so much. Thanks, Jamie. Thanks, Godfrey.
Thanks very much, Jamie and Betty. We're running out of time, but we want to make some few recommendations and reflections on how we are moving forward with scaling up parenting for respectability. So first of all, what we have seen in terms of scaling up considerations, we've been very active disseminating the program right from the beginning locally in Uganda. So we've achieved quite impressive coverage of the program on local print and TV. And we have made significant progress in positioning Parenting for Respectability as a highly respected program in the country through our support for another project where both Jamie and I are co-investigators, with myself being the lead. The program is called Uganda Parenting Agenda Initiative, which is a consortium that brings together main actors in the field of parenting. And so we've disseminated this work quite a lot, the newspapers and so on, and we've engaged quite a number of conversations with policy and program people in the ministries of gender and health, as well as education. Next slide. So through these engagements, next slide, through these engagements, we have been able to attract quite a lot of interest in the program, and several actors, NGOs, have expressed interest in scaling up the program across the country, but also in the region. But one of the things that is really exciting us right now is the opportunity to evaluate the delivery of parenting for respectability through digital platforms. So through the Global Parenting Initiative program, we are adopting PfR content and using the architecture that has been created by Parenting for Lifelong Health. And we are going to evaluate this in Uganda. But what we want to do is to see how to deliver both digital and hybrid at population level. And throughout this, I think it's important to continue to learn about the scaling up. So we planned several implementation science studies, as well as leadership capacity development. And we have an opportunity through the Global Parenting Initiative to train masters and PhD, as well as a postdoc, who in this case is actually Betty. So there's quite a lot of excitement and a lot of interesting things ahead, and we will definitely come back to you in due course. Jane, so I want to thank you very much for listening to us. Sorry we overshot the time, and now we have some few questions, and I don't know whether we can actually answer them. One of the questions that has been raised, I think the very first one is by Makerere, is asking about the rationale for 4 facilitators per group. Actually, so when we establish a group in the community, we recruit 40 parents, male and females, and we split the group into 2. Initially, a male-only group and a female-only group. So each group is facilitated by 2 facilitators. One is an assistant facilitator. So when we finally combine the groups, then we have 4 facilitators. Casey asked a question about the families, and I think, yeah, she was wondering whether these are biological parents only. No, the design is that we are looking for all parents, whether you're biological or any other caregiver, just like you described about the socially distributed parenting in African setting. Annie, how much more? Jen, how much more time do we have?
Godfrey, we can actually take a few more questions. I mean, you could answer a few more of those questions. We'll go over time a bit, and whoever can just stay online can stay, and then we will share the recording afterwards with everybody that's here. So you can go ahead, Godfrey.
Thank you. So I'll answer one more, and I invite my colleagues also, if you can give an opportunity to Carol, who is in the call. So there's a question from Makerere about how well developed is child protection at the national policy level. I think that child protection in Uganda is really well developed. There's a national child protection policy, national policy for children, and there's quite a lot of advocacy by child protection agencies. Actually, there has been a very active group called the Ugandan National Child Protection Working Group, and they've been based on the Ministry of Gender, Labor and Social Development. So in terms of strategies and policy, child protection is well developed, but what is lacking is actually a policy or strategies on the national parenting programs. And that is why we developed the National Parenting Agenda Initiative, which is a consortium bringing together actors as well as governments to work in a consensus manner to develop the national parenting strategy. And so this initiative has actually quite been very useful. We have supported the government in developing national standards for parenting programs, and currently through UNICEF, we are also working to support the development of a national manual for parenting programs in the country. So there's a lot of promising work from the parenting space to try and support the well-developed national child protection group. Carol, I wonder whether you are online and whether you can answer a question around how we ensure socialization and respectability. Carol, are you there? Jen,
yes.
is Carol, okay. If you could take on that question.
Okay, thank you, Godfrey, and thank you, Jamie and Betty, for such a wonderful presentation. So the question is, how do we ensure respectability and socialization in the program, right?
Yes.
That's
yes.
right. Yeah.
Yes, just from the name of the program, that is where the concept of respectability comes from. So during the processes of mobilization, we draw attention to the participants or the people we are mobilizing about what everyone in our setting in Africa values. We just re-echo or remind them their own words, because we all know that fathers, mothers, and all members of the family are concerned about the respect of the family as the larger family, but also fathers are concerned about the concept of respectability, to see that children do things that earn them respect. And so likewise, even women or mothers are concerned about the respect that comes from the family because of the behaviors of their husbands and children. So we remind them about that concept. And so we draw their attention that such a parenting program will help them re-echo some of the things they do at family level that helps them to be respected in the society. And that way, the aspect or the concept of respectability is like branded to the program at the start. And also the concept of socialization, as Godfrey has explained at Betty, that this is a group, it is delivered to parents in group. And we all know that in our society, one of the easier way that we socialize is through group gatherings. We like group work. So by encouraging people to attend parental session in their village, with their neighbors, with their friends, with sometimes their relatives, it encourages socialization, because people will re-echo some of the things they value at family level and community level. And so that way we are able to link or to lean the program on the aspects that motivate learning in community settings here in Uganda.
Thanks.
You.
Thanks so much, Carolyn. And just to add how we measured that with the items and scales that we developed were over the course of the different piloting phases that we did of the Parenting for Respectability program. So gender socialization was measured using 8 items, and they looked at a series of statements looking at like gender roles, for instance, like changing diapers and giving kids a bath, or feeding the kids are a mother's responsibility instead of a father. So they're looking at like different types of gender socialization, either inequitable or equitable, and then we reverse it. So it could be an item that looked at equitable gender socialization. And the same thing with respectability. We asked, there was only 2 items. So it was a small, short scale, but it was looking at their attitudes towards parental responsibilities regarding respectability. So whether it was important to force children to respect others, or is it, how do you model respectful behavior? So how often do you show respect to your child? And these were developed in collaboration with community members, as well as looking at like what other gender socialization, especially the gender socialization measures, other scales that existed out in the field. Back to you, Godfrey.
Oh, thank you very much, both. So another question is, impressive results, thanks for sharing. Could you please elaborate if the program could be adapted for contexts where children are unaccompanied, e.g. refugee camps, transit, and so on? Also, do you know if some of these positive outcomes have been spillovers across the community? Thanks very much. We implemented this program in one of the districts in northern Uganda, where people were displaced for a long time, but they had now gone back to their families, to their regional land. But we don't have experience implementing in refugee camps. Right now, we have an opportunity to do that with some of our collaborators under the Global Parenting Initiative expressing interest to explore how this program could work in settings like that. As to whether these outcomes are spillovers, I think so. They could be. They could be some spillover to the community, because actually it is expected that when parents attend the sessions, they go back to do home practice exercises with their family members, which includes the wider family. And of course, we've had men and women telling us that the other people admire them in the communities, and they keep saying, oh, you are now different people. And I think there is quite a lot of spillover. It is also our expectation later on that we are going to evaluate how the program is continuing to be disseminated by local facilitators whom we trained and left, but also through maybe a design
Godfrey, can you hear us?
Have we lost him?
It seems that way.
Okay. But we could maybe move to another question. I thought there was a very interesting one from Fiona Burr around the promising, even if people attended only 11 of 16, and could we reduce it to 11 sessions then? The challenge is we do not know which 11 sessions are the ones that people need to attend. So if we just cut the sessions to 11, we might be cutting actually parts that are important. But additional work is being undergone in the hybrid delivery to see if some of the sessions can be delivered via digital or remote means, or can be done but through like a population level and alongside some of the more interactive. But the challenge here is that when you're looking at a program that is trying to address both deeply set gender norms around gender and parenting behavior, it does take time to change. And one of the take-home messages is that a one-off intervention, that is the lecture, is just not going to be sufficient enough to sustain changes in both partner relationships and in parenting relationships. So maybe down the line, we would be able to compare a shorter version of Parenting for Respectability, but some careful consideration of which content or sessions could be either combined or reduced would need to be necessary, instead of just cutting down to 11 sessions. I hope that's helpful. It might also mean that you have to offer 16 sessions to get 11 out of 16, or around the 67% attendance. And so if you offered 11 sessions, you might only get attendance of 6 or 7 sessions. So there's a lot of work to be done in that area, and it's something that we hope to address in the Global Parenting Initiative.
I'm just having a look at the rest of the questions, and I'm wondering, I think most of them have been touched on. Is there any other questions or comments? I think because we've gone over time already, please feel free just to send, and he's actually popped it into the chat. You can just send additional questions, and the team, you can reach out to the team directly. I think I'll wrap up the session and just say thank you to our presenters for sharing this amazing results, and we look forward to what's to come from this team in the future. And thank you to everybody for attending. We hope that it was useful to everyone, and we look forward to seeing you again in similar forums. Take care.
Thank you very much.
Thank you. Bye.
Thank you to Godfrey and Betty for being
Thank you,
co-presenters.
Jamie. Thank you, Godfrey. Thank you, Carol.
Everyone. Thanks, Jamie.
Thank you, everyone, for organizing.